and Nerve Center Nigeria is the first non-surgical spinal decompression center in Nigeria, providing non-surgical treatment for chronic and severe back pain, waist pain, neck pain, arthritis, spondylosis, and sciatica using the latest technology. For many Nigerians, treatment options have traditionally been limited to pain medications or spinal surgery, either locally or abroad. But this center is changing the narrative. Joining us this morning is a top-rated U.S. expert and spinal decompression specialist, Dr. Craig Slapinski. He is the clinical director and co-founder of Spine Nerve Center Nigeria and Ghana. Good morning, and you're most welcome to the show, Dr. Slapinski. You look very good in your
Thank
attire.
you.
All right, so let's go straight to the conversation today. So who is Dr. Craig Slapinski, and what exactly do you do at the Spine and Nerve Center?
So we focus on severe and chronic back and neck pain. You see, most people that are having pain in their back or neck, it's a problem from what's called their intervertebral disc. So if we look at the model of the spine that I have here, you have two bones that are separated by a cushion. And over time, this cushion begins to wear out, it breaks down. And when that happens, that puts pressure on the nerve, and then that causes that pain that a lot of people can experience.
Well, people complain about chronic back and neck pain a lot. What are the causes, and what are the best ways to treat these conditions?
Yeah, there's a lot of different things that can cause the back pain. People that are, it's repetition primarily, people that are sitting too long, people that are lifting too long, driving too long. If you're lifting improperly, all those things begin to break down the disc in the spine.
Especially for men.
Yes.
Whenever has back pain, that's serious implications.
Back pain is one of the leading causes of people to go see a doctor. It's very prevalent, and there's a good chance that that'll happen to you at some point, and the results can be debilitating, especially for men that are trying to work and provide for their family. It can really stop them from doing that.
So are these conditions the same as sciatica, spondylosis? I mean, can you expatiate more on this? And what is the difference? Sometimes people get this burning sensation, tingling in their leg and feet. And how do you treat that?
Yeah, sciatica is a condition where there's an issue with the disc in your lower back, and then that causes pain to radiate down the spine. But a lot of people that are getting burning pain or tingling pain, it can be from, again, an issue where the disc is bulging out and hitting the nerve here. Or it can also be something called peripheral neuropathy. That's when people most commonly are diabetic, and they're not getting enough circulation to their legs and their feet, and that can cause a chronic burning sensation too. So that's the other main thing that we treat at our office.
All right, that sounds good. So arthritis is a very common condition, especially among the elderly. Is that part of what you treat?
Yeah, absolutely. I mean, most of the people that are coming in to our clinic are older. As you're getting older, if you're not doing the right things throughout your life, the spine begins to break down, wear down, and then you begin to shrink. So you're as you're breaking down, the disc is breaking down, you're putting more consistent pressure on the nerve. So the treatment that we do for all these things is that we gently pull the vertebra apart. So we have a machine that's very specific that'll help to create a negative pressure to retract that disc and then take pressure off of the nerve. So that's part of the treatment that we do, but then we also do other things. It's a whole program to rehabilitate the spine. So we're doing exercises, we're doing electrical therapy, we're also doing something called cold laser therapy, where we shine a strong beam of light into the soft tissue. And what that does is it helps to stimulate the mitochondria, or that's the energy cells of the cells, and then helps to regenerate.
How is this non-surgical procedure a better approach than surgery?
Surgery is very rarely the best choice for people that have chronic and severe back pain. And I'm not saying you should never get surgery because yes, there are certainly times where it's necessary and needed, but there's a lot of risks associated with surgery. You know, you're cutting into the spine, you're removing part of the disc, you're removing part of the bone that creates scar tissue. Even in the best case scenarios, most surgeries only last about 7 years. And that's if everything goes well. And there's a good chance that you could be coming out of that surgical table worse off than you were going in. And when that happens, you can't go into the surgeon and say, you know what, this didn't work for me, undo what you did. It doesn't work like that. Once you do something surgically like that, it's done. And then if the surgery didn't work for you, what are your options? Well, the option is to go in and have another surgery, that's it. So what we offer here is something that's incredibly safe and it's incredibly effective.
So who is predisposed to all these conditions? Are they professionals, occupations that are more prone to this neck and back pain?
You know, the neck and back pain is becoming more and more prominent. People are sitting longer and longer. People aren't as active as they should be. People are down, they're looking at your phones. I'm seeing so much more issues with the neck than I did 15 years ago when I first started this. Again, people are always looking down. That puts a lot of pressure on the spine, and then that can cause that neck pain. So people that aren't getting enough movement in their day-to-day activities, that's going to predispose them to having these issues.
Something we say in Nigeria, prevention is better than cure. So doctor, can you give us some tips on how to prevent one from coming down with these conditions?
You know, the best thing is to have, is to get movement into the spine. You know, if you're somebody that sits all day, the best advice I have for you is to start walking. 20 minutes in the morning, just to start getting movement into the disc. You see, when we're looking at, again, the model of the disc does not get any direct blood supply. It only gets nutrients through the surrounding tissue. So if there's no movement into the disc begins to break down. It's not getting, it's not able to breathe. It's not able to eat. So by getting movement into the spine, you're helping to heal the spine, keep it strong.
Yeah, man, what are the results like? What does the statistics say about decompression and this non-surgical approach?
So if you look at the research, it's about a 90% success rate. So it is very effective. And at our clinic, we do everything we can to screen the potential patient to see if they're a good candidate. So a thorough exam and history is taken. And then a majority of our patients that come in, they actually get an MRI. Now the MRI helps us to, we're able to see what's going on, not only with the bone, but the disc and then the nerve, so we can say, hey, you know what, this is gonna be a viable option for you, or no, it's not gonna be a viable option for you. You may need to consider surgery, or we may need to look at other things. So the MRI is pretty essential for us to be able to say, if you're gonna be a candidate for the procedure.
So your center's been open in Nigeria for about a year now. What has been the feedback like, from the patients? Are they excited about non-surgical treatment options here in Nigeria? Because I remember you were here when it all started.
Yeah, I was when we first started. It was about a year ago, yes. And so we opened up the clinic in Abuja, and I mean everything was going so great that we kept on getting so many requests for us to open up an office here in Lagos. So now we're here in Lagos, and yeah, no. So
that's growth.
Yeah, so
in 1 year.
In 1 year, so we just opened up.
Well done, you.
Yeah, thank you. So we haven't had our official grand opening, but we are now just beginning to see patients here in Victoria Island.
Oh, that's excellent. So where's your center in Victoria Island? And welcome to Lagos, the Center of Excellence.
Yes, thank you.
Well, tell us what's your center? Is it the same? Would you have the same treatments that are available in Abuja here in Lagos, and where is it in Victoria Island?
So so the treatment that we're doing, I mean, it's the exact same treatment that we're doing in Abuja. There's no loss of quality. And I will say this, the quality of care that we're providing here in Nigeria is the same as what it is in the U.S. Mm-hmm. I operated a decompression clinic for 10 years in the U.S. before coming to West Africa. So yes, the quality of care is very, very good. As far as like where the location is, I think the easiest thing is that if we just Google Spine and Nerve Center, Nigeria, you'll find a link to the map, and you can also look at our website and then get a better idea, a better understanding of what it is exactly that we do.
Okay, doctor. How can our viewers book an appointment with you? And, there's a big market there. I know a lot of men who have waist pain problems, but how affordable is it? That's the other question.
First of all, this option is far more affordable than surgery, and it's more effective than surgery. So it's a better option I believe, for a majority of people that are considering surgery. As far as like coming into our clinic, I would really encourage you to give our office a call. We operate under appointments, so it's far better to, I've noticed in Nigeria, people like just coming to the clinic, but we do see a lot of people every day. So in order to get the best, give our office a call. So again, just Google Spine and Nerve Center in Nigeria, and you'll get our phone number, and you can look us up. And
the phone number is actually on the screen.
Oh, okay,
Your
great.
Abuja Spine and Nerve Center, and also the Lagos one is just scrolling now, so people can quickly record that and call you.
Yes.
I want to pick your brain a little bit on sciatica, because a lot of people are coming down with sciatica. What will be your advice for them?
So it depends on the severity of the condition, and we need to know what's causing the sciatica. So primarily it does come from an issue with the spine, but then there's also some other issues as well, and there could be some muscular issues in the buttock and in the lower back. So if you're having issues with sciatica and it's just something that's starting out, I would encourage you to ice and do some gentle stretches. But if it's persisting and it's not getting any better, or it's inhibiting you from sleeping or sitting or walking, then it's time to see a professional, or best bet would be to give our office a call and see what we can do.
Okay.
All right, that sounds great.
Thank you, doctor.
Thank you very much. We're really glad that you've come out to talk about this very important subject, and also congratulations on the opening of your center here in Lagos.
When is the
very
launch?
quickly.
April 11th.
April 11th, the launch.
Oh,
Yes.
brilliant! So still 2 more months. So for now, people have to go to Abuja.
No, people can. We are open now. We just haven't had our grand
launch.
opening.
Okay.
We're working things out. We're getting everything situated for when things really.
Would people have the opportunity to have like a test day to come in, or just an open day to have a look at your equipment, your services?
Well, before the launch, if anybody wants to come in and take a look at the clinic, we would love that.
Oh, great.
So please again give our office a call and set something up. And if you're just curious about what we do, come in and bring your MRI if you already have one, and then we can take a look at this and we can do a preliminary check to see if it's it's an option for you. But yeah, absolutely, come to our clinic, take a look and see what we're all about.
Excellent. Thank you so much. I must ask this one from the producer. He says, how about people who resort to taking traditional herbal drinks to treat their back pain? What would you say to people like that?
If it's working for you, it's good. If whatever you're doing right now is working, that's okay. But with the traditional medicine, it can have an anti-inflammatory effect, and then that can be good. But it doesn't fix like the issue with the disc. I mean, same with medication. When you're taking medication chronically, it masks the symptoms that you're having. It's akin to, you're driving along and your check engine light comes on, that there's something wrong with your engine, and you just put a piece of tape over that check engine light. That's what medication does. So it can actually make the situation worse. That pain is there for a reason. That pain is there to tell you not to do this. If you're not supposed to be sitting too long or lifting or walking too long, don't do that. Listen to your body. Right. So if we're negating that message, you're going to cause more damage to the spine in the long run.
Thank you very much. I think that's a very important message. Thank you so much, Dr. Slapinski.